This conference will now be recorded.
So I'd like to introduce our first speaker today. For today, I'm sure most of you know her well, Cap Wilkes. She is our Senior Program Coordinator with Rural Health Innovations, and she's going to start us off. Cap?
Great, thanks Angie. Hello everyone and welcome to our webinar. We are pleased to have you here with us today. We're going to be talking about marketing today, and specifically we'll focus on the student aspect of that, although we're going to mention that there's other aspects of your marketing that you'll be needing to address as you think through your strategic marketing plan. So we're going to have our agenda. We're going to do some welcome time here and get started. I have a presentation that I'd like to spend some time on related to a strategic marketing plan. And we have a guest here with us today, Jeremy McNamara, Health Science Program Liaison with the Normandy Community College Health Sciences Program, is going to also share some of the marketing efforts that organization has been going through. I'll do a little bit more of an intro with Jeremy just before his presentation. And then we'll wrap up. And this will be a pretty full webinar, actually. We have 60 minutes to get all of our talking in and presentation and knowledge sharing. So I think we're going to go ahead and get started. Thank you very much for adding your names and network organizations to that on the right side. That does help us not only keep track of who's here as we go through the recording, but also for you all to know who's here and start learning those names and projects as you get. We're going to be in this together for the next 2.5 years, so it's great to get a chance to put those names and organizations together. Now we also have Marcia on the phone. I see her in the participant list. And so Marcia, I just wanted to do a little bit of a pause if you would like to say a hello and have people hear your voice today.
Good afternoon, everyone. It's always a pleasure to speak with you all and to be in the position to be able to share. I'm very excited about this particular webinar. Of course, the webinars we come up with as we have spoken to you all and kind of thought of what some of the needs are. And I'm not going to continue to talk so I can, but I just am excited, and I'm excited about all those that are participating today. Thank you very much, Cap, and the team, Angie.
All right, thanks, Marcia. And good point. We came up with this topic through talking with you and through you taking the time to share with us what you're working on and challenges that you face. Kind of a global thank you for filling out the TA assessment that we had sent out earlier in the year. And that's the kind of opportunity we have for finding topics that we hope are both relevant and timely for you. I'm going to switch over to our presentation now. Angie, as it's loading up here, Angie had mentioned that you can type in the chat box if you have a question. And also I will keep track if you want to raise your hand, which is a way of doing that in Adobe Connect. At the top bar of your screen, there's a little person with their hand raised. If you click on that, that will signal us that you've got something, a question or a comment. That's a nice way for folks to hear each other's voices, so I really encourage you to use that if you've got a question or a comment to share with the group. So here we are getting started with a strategic marketing plan. And I wanted to tell you a little bit about this presentation and the resources we have for you today and a little bit about my background. This particular presentation and resource, and I'm mentioning resource, I'm going to call this out. I'm hoping that you all can do some downloading, and so you have kind of a participant activities worksheet or handout that goes along with this presentation. In the lower left of your Adobe screen, there's a file share. If you highlight and click on Handout Participant Activities, Session 1, it allows you to push the button on the lower part called Download Files. This will bring, it's a Word document, and will come right to your own local computer. So if you would go ahead and do that and open up the document, you can follow along, and actually I'll be pausing in my presentation for you to do some thinking related to some marketing efforts. So go ahead and work on that. If it doesn't work for you, we will send this out via email directly following this presentation so that you can have that available to you. And it's pretty simple and straightforward, so even if you just take notes down today, that will be helpful. So the Strategic Marketing Plan presentation and the accompanying participant activities resource was developed by a marketing professor at a college in southern Wisconsin, and Moses Adams is his name. And he put this together for us, customized for rural health networks, because we wanted an opportunity for you all to have some real straightforward marketing guidance. And we put it together in a way that it's both a worksheet and the information so that it can help you ask the kinds of questions that get you thinking about marketing. It provides really a framework and a checklist for thinking strategically about your messaging and other marketing efforts. I have an MBA, and I've been working in many kinds of organizations over the years and have bumped into and used marketing in all shapes and sizes. I recently used this particular presentation and activities handout with a HIT workforce grantee this last summer. It was a nice way of customizing our resource to a workforce-oriented project. And so Angie and I have taken some time to customize it again and bring it into alignment with your rural allied health training program. So it's basically a tried and true presentation and worksheet, and we're looking forward to sharing it with you. The Rural Health Innovations is a subsidiary of the National Rural Health Resource Center, and we work really hard to connect rural health organizations with innovations that enhance the health of rural communities. That's our focus and value proposition. We wanted to spend some time on some common language related to marketing, and this marketing cycle, I had presented this to you, to those that were able to attend in Portland to our grantee meeting there. And it's a way of providing some language around the aspects of your allied health workforce training efforts. And I present it to you just really as a way of, even if it's just for this presentation, to have some language we can share. So as we get started as you all get started in your projects, there's the phase one, which is really planning and developing, understanding what's going on with your students and your members and those preceptor organizations, developing curriculum that's pertinent or finding it, figuring out if it's going to be online or in person, and all those different aspects of getting started. Phase two is actually starting to enroll or recruit the students into the program itself. Phase three is the learning piece, and in a sense retaining your students. Phase four is about the internship or practicum aspect of your efforts, and it includes both the recruitment and the retaining of those preceptors, both as individuals, trainers, so to speak, on site for the clinical aspect, or those organizations or facilities that the preceptors work within. So there's some recruitment and retention in those organizations as well. And phase five being the students have graduated, they've done their job and their work, and now they're ready to be employed, and there's some recruitment and retaining relative to the workforce. So that's from a marketing cycle, it identifies that you have various aspects to consider as the program is developed and implemented and executed, and then around the cycle again for another group of students. Also for this webinar in particular, we'll be presenting with you a particular checklist in the preparation needed to be strategic with your marketing planning. And for this, we're going to develop a situation that I believe you'll be able to relate to. It's simplified, but the basic service, let's say, is that you are providing student training in the form of some kind of didactic or lecture-based or book-based or some kind of real sit-down and learn things environment, and also a practicum, an internship kind of environment for that training. And that's your basic service. And then the result of that is a work-ready workforce, folks that are ready to get started using what they had just learned through your training program. So I'm presenting this as it starts kind of providing us with a little scope in our conversation around marketing and how we approach being strategic with our marketing. So these are informs the rest of the webinar, so we're going to be talking about your training. We also want to have some agreement or understanding anyway about what is marketing. So some of the basic thoughts about marketing is often thought about as a selling or advertising activity. And true, marketing is certainly part of us being convinced that there's an amazing new product that will solve all our problems, kind of selling or salesmanship. But marketing also sells ideas. So, for example, seatbelt saves lives is an idea, and marketing was used to communicate that. It does more than selling, though, selling of things or ideas. The American Marketing Association's definition: marketing is the activity and processes for creating, communicating, delivering, and exchanging offerings that have value for customers, clients, partners, and society at large. So marketing is satisfying customers' needs over time. The question really is, how does one satisfy customers' needs? And we're going to introduce a framework to you. And I also had presented the 4 Ps of the marketing mix in Portland to the folks that were able to participate there. But I want to bring it back because it's really an important framework to use, because it gives us things to think about when we are talking about marketing, and we don't get stuck just imagining marketing as the promotion piece, the advertising or the branding. There really is more to it. So the 4 Ps of marketing I want to just go through quickly so that everyone's thinking about marketing in this broadest context. So product typically refers to the overall offering. It's not, for example, just the Mountain Dew inside the can, but it's also the can, the shape of the can, the size, the design, the colors, and the information on the can. It's also the distribution system and the price of the soda. There's much more to it than just the pop that's inside. In the case of your network, the product is the set of services you provide to your members. And for us today, as I had just mentioned, we're thinking about the student training that includes both a didactic and a practicum. So pricing is what you charge for the product, and it's a function of what it costs to produce it. At least over time, it needs to be a consideration. In the case of your allied health project, this includes how you approach the concepts and the decisions around tuition or scholarships. It also really incorporates aspects of in-kind time and resources and space, because you're really suggesting and asking partners and stakeholder groups to participate in a program that may very well include in-kind. So thinking of that as part of the price or cost of your service is also important. Place is another aspect of your marketing mix, and it really refers to the distribution of the product and how it's made available and how it gets there. So in the case of your network and this allied health training program, place has to do with how and where you make your training available to your students. Is it in person, on campus? the vocational technical institutions online. What healthcare facilities are a part of that? What time commitment is involved in the clinical, and which clinical settings are being involved in the training itself. So place is a piece of your marketing mix. And then finally we get to promotion. So promotion is the P that's most commonly treated as synonymous with marketing. And most people really very often think marketing is about advertising. Well, it is a part of the marketing mix and promotion, but advertising isn't the only piece. There's other aspects of promotion: public relations, branding, social media, quite a diverse set of activities even in the promotion aspect of our marketing mix. So I bring you the 4 Ps as part of marketing: product, price, place, and promotion, to give you a framework to really approach your strategic thinking around your marketing. Now, the strategic marketing plan, what is that? It is really a document that becomes a go-to resource for you. It provides you with the components that helps everybody understand what's going on within the 4 Ps and strategically how you can get your service to meet the needs of your target populations. So let's take just a minute to talk about the elements, and we'll move right into the components of your marketing plan. The elements of a strategic marketing plan, there's 7 of them listed here. They give us the roadmap that helps us be effective in moving towards an effective effort in marketing. So you wouldn't get in your car and start driving without a plan or without a map, and you shouldn't start marketing without your marketing plan in place. The components, project mission and values and vision, and the environmental scan and analysis are really part of your larger project. And for this webinar, we're going to assume that you've gotten that work done, and it's really part of your grant project. You've identified mission and vision. If you haven't done these things, we really encourage you to get with your advisory committee and your board and talk through what exactly do we all agree is the mission and vision of this project. We always include values as well, because the values, as they're discussed and shared within a project, helps really define the behaviors and the approach that an organization will have, or a project group, a work group will have towards its vision and accomplishing its mission. Values could be things like being collaborative, student-focused, perhaps flexible, those kinds of behaviors that help us all get our work done together. I'm just going to highlight that mission is really about what you do. Sometimes it asks a question why you exist, but it's really, in most practical sense, is the largest goal of your project. The vision is really around what you want to do or become, and sometimes I think about it as what do you want to achieve. When all of this is said and done, your project, what do you want to have achieved? And that is a way of describing your vision. Now, your environmental scan and analysis can take all kinds of forms as well, and that would be something that, again, would be a part of your project effort. So what we're going to do for the rest of the webinar is dive into the components: define the target market, a competitive analysis, the value proposition, and the historical scan of marketing activities. The strategic marketing objectives is the last step in creating a strategic marketing plan, and we're going to have that be next steps after this webinar, hopefully preparing you for formulating those strategic objectives, specifically for your marketing. So we're going to start with defining the target market. Based on the work you have done in your projects, environmental scan, and in consideration of those 5 phases of the marketing cycle, I'm going to continue building on our kind of a simplified scenario today that the Allied Health Training Program has 3 basic target markets. So when we were talking through those 5 phases, we said, well, your students are certainly part of your target market. They are going to need to be recruited and retained into the training aspect. We also have the preceptor organizations as a target market because those organizations and the preceptors themselves, they need to be found and they need to agree to participate. And then there's a target market related to those hiring organizations that will take the workforce that has been, the students that have completed their training who are now ready either to enter the workforce or transition into new jobs or to add additional responsibilities to their work. But those hiring organizations are a target market as well. Target markets are those groups or an audience of your service that you are providing. And the real question when you're doing marketing work is, well, how well do you know them? I'm going to ask you to now take a look at your activities worksheet, if you were able to download that, or I'm going to change the page here. We're going to just spend a few minutes actually thinking about defining your target market. So in this webinar, you guys are going to do a little bit of thinking, and if you don't have the handout in front of you, you could just take and jot down some notes, either on a pencil, pad or paper, or even in wherever you would like on your computer, whatever. But ask yourself these questions, and I'm going to pose a few questions. You guys are looking at your defining the target market, which is on page 5 of your handout, and start jotting down some answers. I'm going to be quiet for about 2 minutes while you are thinking. But let's focus first on your students that you're enrolling in your program. What do you know about them? Ask yourself some really pointed questions like, why are the students interested in this program? Where are they currently employed? Or if not employed, what are they doing? What might be motivating those students to pursue an allied health training program? What does the student perhaps wish to achieve, or aspirations do they have? Maybe even how much do they want to earn? What are they hoping to achieve financially? What kind of stability are they looking for? So I'm going to stop talking, and this is just going to be a little bit of a pause in the webinar where you get to do some thinking and actually do some work on defining your target market. First, thinking about the students. We'll just give you 1 more minute, jotting down your thinking about the target market of students. The trick when working through developing your marketing plan and thinking about each aspect of your marketing plan is also to think about each of your audiences. So today we're really focusing in this webinar on the students as your target market. But you'll need to go through the same exercise for the preceptor organizations and also for the hiring workforce organizations. So each of your target markets, you need to work really hard to understand them. So there's other ways besides you brainstorming on your own. Other ways of gathering data about your target market is to do some Google searching on the organization itself, on associations related to those types of efforts, perhaps. Having key informant interviews, even focus groups are good ideas. Asking folks that you already know that are doing the work through surveys, online surveys or in-person surveys. So this is the gathering data section is understanding your target markets. All right, I'm going to go on to the next component of getting ready for your being strategic around your marketing plan. And that is to consider the competition. So we ask ourselves when we're thinking about our competition, who provides benefits similar to ours? Or what issues or situations distract students from participating in our training program? Well, this sounds simple enough, but there's a lot to this. Oftentimes our perspectives are actually quite narrow. For example, let's give, I'll give an example of in a town, there's only one playhouse, for example. And you think, well, there's only one, so there's no competition. But the playhouse does have competition. There's maybe the local movie theater, or there's a comedy club, or there are other places that provide evening entertainment. So how you define competition, in fact, makes a world of difference in the steps you take to deal with it or to understand it, and that is going to impact your decisions in your marketing. Also, in understanding your competition, whatever it is, the competition has strengths and weaknesses as well, and the more you know about those competitors, the better you'll be able to effectively manage those challenges. And understanding your competitors can also identify best practices because it allows you to generate useful ideas without having to reinvent the wheel. So you ask yourself, what did I learn, or what insights did I gain from studying the competition? So we're going to pause again and have you do a little application activity. So number 4, which is on page 6 of your handout, or if you're just taking notes, think about the competition to your training program. And again, for the sake of this webinar, we're going to concentrate on just the aspect of providing a didactic and practicum training environment for students related to allied health. You might have a more complex service that you're providing, but whatever it is, think about what is the competition, what distracts your students from participating or enrolling, or what is a direct competitive environment that your program might be within. And for each of those items that come to your mind as competition, list out the service, think about the strengths or the weakness of that particular competitor, and what marketing activities that competitor is undergoing or engaged in. So give it a little bit of thinking. On the last column in that chart, in the chart format in the handout, is also to write an overall assessment for each one of those competitors. And this is really the analysis piece. So you're saying, if this is what I know about the competitor, then what insights have I gained, or is there something I can learn from that competitor that will help me in the marketing efforts I have within my service? I will give you about a minute to think about your competitors, who they are, what services they're providing, the strengths and weaknesses of those services, the marketing activities that they're engaged with, and then an overall assessment of that competitor. All right, we're going to move on to the next component of preparation in our marketing efforts. And this is to understand your program's competitive advantage. So what are the aspects of the product or service of your program, which in this webinar we're talking about that being specifically the student training, that differentiates the program from the competition differentiates the program from the competition. So when we're thinking competitive advantage, what we're talking about is what can we do that our competitors can't do? Or what can we do that really meets the expectations of our students? What makes our training program outstanding, and what can we do that others can't do? So our encouragement is to be very specific and concise and as accurate as you can, because as you identify your specific advantages, that's an aspect of your marketing plan that will be more robust and you will be able to be more dynamic with it if you are more specific. Now the value proposition is when you ask yourself, well, what value do I provide? What value does our program provide to the target market? So in this case, how can we articulate the value that our students experience when they're part of this program? You would do the effort of a value proposition writing of the statement of your value proposition for each of your target markets. So your students, your preceptor organizations, and your hiring organizations. The value proposition is one of those things that we often know, but it can be quite difficult to articulate, but it's worth trying. Your value proposition consists of the value you provide to your customers, and again, it's asking the question, why are they participating? What value do they see or experience? In a way, the value proposition is like a promise you make to your target market. And it's an expectation they have of receiving that value. It is actually important for your whole organization to be on the same page about your value proposition, because it will help your organization understand the role that each of those individuals or partner organizations play in fulfilling this promise, this value proposition promise to your target market. So again, we're going to do an application activity because I want you to practice using that handout, because each of these steps is a step to prepare you for being strategic in your thinking around your marketing plan. So this application activity is about value propositions, which includes the question about competitive advantage and then value proposition. So on page 7 of your handout, or if you're just jotting down notes, ask yourself the question, what is the value of the project to our students? Give it a try. See if you can have a couple sentences perhaps that says our students value, and see what you come up with. When I was working with this value proposition particular aspect of the handout, with the HIT workforce, a couple of the value propositions they described was helping healthcare, or for the students, improves marketability of the student. So the student perceived value as being a more marketable and employable workforce in the community. All right, I'm hoping you've written down a sentence or two around your value proposition for, specifically at least in this webinar, for your student training. So the last step in preparing for being strategic in your thinking is to scan your promotional activities, both historically if you've been working on this for a while, and definitely your current activities. So you want to audit your promotion activities because it helps give you insight on your efforts and it helps you prioritize your resources. You're wanting to determine the adequacy, the relevancy, the effectiveness of your promotion activities. So it's about listing out all of the promotion you've done for community events, articles you've written, or you're currently working on, advertising, social media, presentations you've done. And then you want to actually ask yourself, well, why did we do this, and how much did it cost, and how much time did it take, and did it work? So auditing is one thing, and then the next question is, well, how effective have our efforts been? So the last application activity for today's webinar is number 6, and it's on page 8 of your handout, or if you're just taking notes, go ahead and do a quick audit of your promotion activities. What are you working on or have been working on recently? Who was the audience of that promotion activity? What was the frequency that you delivered it? What was the message? What goal did you have when you were putting that promotion activity together? How much did it cost to make it happen? And then lastly, go ahead and rank those activities as in their effectiveness. You could either do that with a note, or you could even rank them from 1 to 5, being 1 was really not very effective, 2, this was really spot on. 5 would be really spot on. So you want to do a scan of your promotional activities so that you can really be aware of the work you're doing and how effective that effort has been or is being. All right, to keep us moving along, I just have a couple more slides and then I'm going to be turning this over to Jeremy. Strategic marketing objectives then is the last step. So we have been doing all this work to get ready to answer the question, what are the key marketing objectives that will guide this organization or project towards the vision? And our tips or suggestions are, don't do this alone. Sorry about that spelling problem there. Don't do this planning alone. Include your staff and key stakeholder groups. When you're doing your marketing objectives, or these are your big goals for your marketing, use the 4 Ps of marketing to guide your thinking. And as always with objectives, if you want them to really get done, try to be smart with your objectives. So your SMART objectives are specific, measurable, attainable, realistic, and timely. And if you try to keep those 5 guides in mind when you're writing your objectives, you'll have much more luck getting them done. So in summary, the elements of a strategic marketing plan. Always, as a project, you need to know your mission, values, and vision, and you need to be aware of the environment that you're working within. Specifically for marketing, you need to define the target market, be aware of the competition and how it's affecting your target market, be able to articulate the value of your service to your target market, keep up with your marketing activities, know what you're doing and how effective they are. And when all of that prep work is done, you'll be ready to enter into an event where you can really understand and come up with strategic marketing objectives. Where you'll be using this marketing plan when it's all done is it can be part of your business plan because it's an important part. It also is the go-to resource document for developing your promotion, for understanding your pricing, for being really effective with your product and place. So your marketing objectives is the map so that you can be effective with your marketing work. We'll take some questions at the very end, and always Angie and I are available for your technical assistance questions, so if they come up. I'm going to move over to Jeremy just so that I'm not taking up any more of his time. I just want to make sure to highlight to you all that the Normandale Community College, it's a college in Bloomington, Minnesota, and Jeremy is the Health Science Program Liaison. And he's going to share with us the marketing effort of that college in the Health Science Program. And the reason we asked Jeremy to join us, and we really are appreciating his time and willingness to share his insights, is that the Normandale is a partner organization with the HIT Workforce Grantee here in Minnesota, the Mentor project with the Lackey Pearl Rural Health Network. So Jeremy, I'm going to cue up your presentation and pass the talking stick over to you. And I certainly appreciate you being here today. So here you go.
Perfect. Like she said, my name is Jeremy McNamara. I am the Health Science Program Liaison here at Normandale. And so what that simply means is that I basically work with students in the financial aid process, the admissions process, the advising process, and anywhere in between that. So I'm kind of the one-all kind of in the health sciences at Normandale. I first started off at Normandale as a basic admissions representative, and I think that was kind of key in my success here at Normandale. I had to take a good 3 to 5 years to kind of build my trust with the faculty members here, the various high schools that are around, kind of around Normandale, and the staff here at Normandale, and that was kind of key to kind of transitioning to this new role at Normandale. And it was so effective that they actually created 2 other positions here at Normandale that are just like mine in 2 other different areas. So it's a relatively kind of new model that Normandale is moving to, but we're kind of putting all our eggs in a basket when it comes to looking at this type of model. The types of degrees that we're kind of offering at Normandale at this moment is a degree in community health education, dietetic technology, dental hygiene, which is one of our bigger health science programs, exercise science, which is one of our newest programs at Normandale, which we'll talk about in a little bit, food science, healthcare system technology, which is kind of like with the HIT. It's the 4-credit program on Normandale's campus. We have 2 types of program. The non-credit-based program, which is through our continuing education department, which is the HIT program, and then we have the 4-credit program, which is the healthcare system technology program. Then we have a health science broad field, which is really critical in students kind of moving to a path at Normandale to kind of figure out, do I want to go into nursing, do I want to go into dental hygiene, do I want to maybe be a surgical tech, things like that. So it's kind of that degree that they can kind of play around with a few different things at Normandale. And then we also do have a nursing degree, and that's probably by far our biggest degree program. One thing I've kind of seen working in this role is whenever you ask who wants to go into healthcare, 6 out of 7 people usually say they want to go into nursing. Part of it's they haven't heard of these other pathways that we'll be talking about in a little bit. We also do have some very short-term certificate programs because we realize students do want to come into Normandale and sometimes get a certificate really quick and to go right into the workforce. So we have a community health worker navigator certificate, an exercise specialist certificate, which is a personal training certificate, and the nursing assistant certificate. So those are the kind of the different the programs that we kind of have at Normandale. And the way that we're kind of moving is we're moving to a pathway model, which where students can kind of take stepping stones. They first start off with a basic certificate program, then move on to an associate's degree, and then can move on to a bachelor's degree. And we've actually created a lot of partnerships to allow students to be able to seamlessly transfer to those 4-year programs, which we'll talk about in a little bit. This initiative, while I would love to say it was just a Normandale thing, it's actually a Minnesota State College University initiative that the chancellor has kind of pushed down to us. the chancellor really has charged Normandale and the other community colleges and the other state universities to really create these partnerships. And part of it was simply because of the simple fact that he really, really wants us to make sure that we're developing programs that are very lucrative for students to ensure that students are actually going for these programs. So now we're going to kind of go back. Yeah.
Jeremy, I'm sorry, this is Angie. Are you using your slides, or do you want me to advance?
Yep, I'll go on to the next slide right now. So I just wanted to give a basic intro first to what we're doing.
Oh, I see.
And then I'll kind of go on.
Okay, I apologize.
Sure. No problem, for sure. So I kind of gave you a basic foundation of what we're kind of looking at. I'm going to talk to you about how we market our prospective students. We really look at kind of two students that we're kind of looking at. Our prospective students, which could be an adult learner versus someone coming right out of high school, and their needs are completely different. But we also look at our current students, and I think that's the biggest strength that we do have at Normandale, is actually look at our current population. What happens a lot of times when I've worked at other institutions is once the students come walking the door, we get them into a program, we just keep funneling them to that. So, for example, a student gets into Normandale and wants to go for nursing. I have further conversations with those students to really kind of see, is nursing the right path for you? So one big thing that we've done at Normandale is really kind of market to our prospective students. And we do have one person kind of in charge of marketing, recruiting, and advising students initially. And that's typically me. I'm not the only person. So again, kind of looking at what we've kind of talked about earlier in this webinar, is I'm not the only person doing that. I work with the Dean of Health Sciences to really look at our marketing plan, to really get a good feel of is our target population appropriate, or do we need to start looking at other target populations? And then where do we actually find that target population? Is it at a workforce center, or is it at a high school? And so we're kind of working with that with the Dean of Health Sciences. I work with the enrollment manager, Betty Blazer. She's an enrollment manager that I work with each and every day, so that once a student kind of gets into one of our programs like nursing or dental hygiene, we can properly advise them and get through our programs. And then I also work quite a bit with the faculty members. I work each and every day with the faculty members. It was kind of crazy when I was kind of sitting in listening to the first part of this presentation. I had 4 faculty members kind of stop in and ask me some questions about our programs and how we can kind of better market our programs. So while I was kind of listening in on the first part of the webinar, I actually set up 3 to 4 classroom visits where actually I'm going into the classrooms to kind of meet with students to really see, are they on the right path? If not, how can we get them on the right path? So I think content mastery is very, very important. When I first started off at Normandale, they told me they wanted me to go into health sciences, and I kind of went into an oh crap moment because my degree is actually math education with a minor in business. And I'm actually working on my master's degree right now, my MBA. So I have never even set foot into the health sciences at all, except my older sister is a registered nurse, and my mom works as a medical assistant. Those are my only 2 connections that I had to the health science world. So I had to kind of get going relatively quick to kind of figure out these programs. The person I was kind of took over, she was there for a week. So I had a week with her to kind of figure out these programs, so it was very critical that I kind of figured it out. Obviously, I didn't learn everything in a week, so then I kind of partnered with the directors of the programs, the faculty members, the Dean of Health Sciences to really kind of get a good foundation within the health sciences, because it's, in my opinion, the only way I can present on something is if I'm really, really sound in that foundation. So I really got to know the programs quite a bit. I worked in and out with the faculty members, so much so that my first year on the job, the Dean of Health Sciences kind of developed this idea of creating this healthcare, this health science program liaison position. She saw some distinct benefits in that because I've developed that content mastery in that. But again, I'm not doing this by myself. I have a lot of partners that kind of work with me on that. For prospective students in particular, I really build rapport with high schools and workforce centers. That's really, really, really important. The students coming out of high school, I really have to build that high school relationship with those high school counselors, with the career centers, with the college centers, things like that. They are the true gatekeepers to students coming to Normandale. I'm going to give you guys kind of an example. I was told I needed to go to this private Catholic school to market to their students. The first time I went there, the counselor told me, they said, Jeremy, there's no reason coming to our school because our students don't come to Normandale. Our students are going to universities or schools that are a little bit more prestigious than Normandale. At that moment, I was like, okay, well, I'm still going to come and see what it's all about. But what she didn't realize is actually 12% of their population actually comes to Normandale. And then if we actually look at the reverse transfer population, students that go to the four-year schools and then come back, it actually increased to almost 16%. So actually there was a lot of students that actually did come from that school, and she was one of those gatekeepers preventing them from actually meeting with me. She would literally tell the students to not meet with me, and so I would never kind of meet with those students. On the opposite spectrum, I do have partnerships with some local high schools that I keep kind of building with, and they're funneling students to me every single day. For example, I've just got 3 emails from my high school counselor that is forwarding me their the students' high school transcripts, a tuition or a application fee waiver, and this week alone she sent me over 20 students that she kind of thought would be a good fit to Normandale. And this school is about 150 students total, and so we have a huge population coming from that high school because of the relationships I kind of built with them. So they're the true gatekeepers. But beyond that, our adult learners, the workforce centers are the big gatekeepers. That's who I go and see and kind of go to the various workforce centers that we have within kind of around the area to really work with them to ensure that these people can kind of get reacclimated into the workforce. We do have general health science information sessions. We do 2 a month. And I'll be honest with you, they're not very well attended. We usually get between 2 to 5 students. And at one point they talked about taking those off the table, and I said absolutely not. And the reason why I feel very, very strongly about that is simply because of the simple fact that this is one more opportunity that I can offer the outside public to really get a good glimpse of what Normandale has to offer. Not only do they have a chance to be able to do that, but they have to actually come to our campus. If I can get someone on my campus, I feel like I can sell them my programs in a heartbeat. But the hard part is actually getting them to our campus in the day and age that we're kind of in right now, with technology being so savvy and people wanting to do more electronic campus visits and things like that. It's very, very hard for me to get students onto campus, especially those high school students. They'd rather text me or email me, but they would rather not come to campus. And I feel like that's our biggest strong point at Normandale. If we can get them on campus, I can start selling my programs. We do also do very degree-specific information sessions. So, for example, I did the information session last week on dental hygiene in particular. Our current students come to those, prospective students come to those. We open that to the entire public, whether that's on campus or off-campus students. I also do advising sessions, and this is where I actually will advise students on kind of in a group basis, but I do it more one-on-one, and I actually advise each and every student that comes to Normandale for the health sciences. I usually get between 10 to 20 students that I'm advising at one point, and once they're done with meeting with me, that we actually register for classes right away. This is actually key in our success at Normandale. This ensures that I can fill my gateway courses, which we'll talk about in a little bit. Those are courses that students will take to first start kind of the process in going through those programs. So it allows me to be able to position Normandale to be able to kind of keep moving forward and to actually feed into our marketing plan. We also offer registration sessions. Again, those are going to be sessions where we strictly just work with students to get them registered for classes. We do 2 open house events. That's not done by the health sciences. That's done by the college itself. But health sciences is probably the biggest partner with that. I'm the only academic programs that offers an information session there. So the health sciences are the only academic programs that offer that, but the other 2 program liaisons are going to actually start doing that this spring semester because they realized how big a feeder program that was. We do go to a lot of career and college fairs. That's probably our biggest thing. I typically don't go to a lot of those career and college fairs. Our admissions team does, but they're very good about getting me their leads. And so I'll ask the director of the admissions team, what did you get at this event? Can I kind of pull those students and email them and see if they have any questions for me? So that's key in a lot of our marketing strategies where I actually don't do those. I do go to some career events, which are a little bit more tailored towards the health sciences, but in regards to the college fairs, typically if they're not health science focused, that usually is an admissions representative going to that. And then like I said, I pull those lists from them. And then it's also really, really important to partner with other colleges and universities. That's our biggest thing that we have right now. A lot of our programs are very lucrative because of the partnerships that we built. Students can actually get 4-year degrees on Normandale's campus. They can actually get 3/4 of their degree done at Normandale and only have 1/4 of the degree left at that 4-year program, which we'll talk about in a little bit. So that's really, really important to partner with those other colleges and universities because students don't only want to know what they can do at your college, but what they can do after. And most of our programs at the community college level do encourage students to go on for their bachelor's degree, so it's really important to have those partners attached to that. For our current students, we're doing a lot of the same things, so I'm not going to rehash a lot of these things. But again, one person in charge of marketing, recruiting, and advising for students is really, really important, especially for current students, because they really want to have that one person that they can kind of contact and they trust. It's really, really important to build a rapport with the faculty because of those gatekeepers. They're, again, those gatekeepers, but they also are in charge of the gateway courses. When I say a gateway course, what I simply mean by that is our nutrition class, which is Health 1107, our nursing assistant class, which is Nursing 1060, our Intro to Exercise Science, that's Exercise 2300. Those are the classes that students that are interested in those programs will start off with. And that's where I'll go visit those classes and ask them, do you want to move on with this degree? If not, what else can we do? And being really, really real with those students by saying, is this the right fit for you? If not, are we going to stay in health sciences? If so, I'll work with you further. If not, I'm going to connect you to a general advisor that can kind of help you further. We do a lot of classroom visits. Like I said, I have just 3 done for next week. We do have some monitors that I market my health science programs while they're at Normandale, so they're all around the health science building that we have. So I put those degree programs and the information session dates, the open house dates and stuff like that on that as well. I talked about the database leads. We have a lot of leads that we get from admissions, so I work with that quite a bit. We do general health science information sessions, degree-specific information sessions, and again, it's really, really important to partner with those colleges and universities. So for approaches kind of in best practice, I think you guys hit quite a bit on those when we talked earlier. Again, content mastery is really, really important. The students really, really want to trust that you have their best interest in mind and that you know the material and you're not going to lead them astray. So, and also it's really important to be honest with them when you don't know the answer, because finding someone that does is really, really important. That builds that trust with that person. You have to really develop pathways for these students to ensure that they can start at a very basic level and kind of move on after that. Creating degree partnerships that are student-focused is really, really important, which I'll show you in a little bit. Being real with students is very, very important. When I meet with a nursing student and I know that they're not going to get into the nursing program, I really kind of explain that to them and I work with them to ensure that they have another path in mind. So, for example, I work with the student this semester. She wanted to apply to nursing, and I put her into the community health worker program, and she absolutely loves it, and she's going to keep going on with nursing, but she's actually going to kind of take a step back and actually go part-time with nursing until she can get her grades up to be able to be competitive for the program. Do not push degrees. Listen to the student. The students know what they want, and they're going to tell you what they want, but if you don't listen to them, you're going to lose their trust. And do not forget about your current students. That's where a lot of institutions kind of lose. They forget about their current students that they have in the pipeline. If you can funnel them through that and get them through those degree programs and build that pathway, they're going to be another recruitment strategy that you can actually pull from. And you also want to build good relationships with students, staff, and faculty. That's important because the students will see that. They see that you're interacting well with other students, so they want to meet with you. They see that you're interacting with the staff members, so they know that you know the content. And so it's really, really important to kind of build that relationship and to work with them. Develop a good support system for these students so they're successful. And regular opportunities for students to be able to meet in a group and individual settings is really, really important. We do night events, we do day events. I'm always offering students to be able to come in at what time's convenient for them so that they kind of can be able to see me at what's convenient for them. Next,
Jeremy,
Jeremy,
this is Cap,
yeah.
And we're running out of time, but so I need to be sensitive to our folks that are on the line. And there is one last slide you have that I think is a nice one. So how about if we go through this, maybe just highlight a couple of things on this messages that resonate with students?
Yeah, for sure. Again, being real with the student versus trying to sell the program. They're going to know that you're trying to sell the program. The first step is really to get them into the door. The next step is to gain their trust. The third step is to sell your program. So, for example, for nursing, what I do is I explain what other programs are out there, but then I explain our pass rate on our board test for nursing is 90%. You know, and that's a good question to ask. I mean, that's really, really important because it shows that our program is very strategic. Explain the various pathways available. Show that students can go from their associate degree or certificate program to their bachelor degree all at your campus or build those partnerships. Students want to see time, money, and location. So for time, we save students by allowing students to be able to get the degree a little bit faster at Normandale. Money, they can do more at Normandale than they can at those four-year institutions. So money is a big issue. In location, they can all do it at Normandale's location. So you have to have distinct benefits for them to be able to take advantage of those programs. If you don't show them those benefits, they're going to go on to the program that does. And then providing really good consistent information is really important, and really make it enjoyable. That's the biggest thing, is they're going to know, again, that you're trying to sell the program. If you can make it an enjoyable experience, something that they're learning throughout their entire time, and you're not trying to push your programs, you're going to gain their trust, and you're going to be able to kind of work with them in the future. Great.
Thank you, Jeremy.
Yeah,
I'm going to pull us to the wrap-up page, everybody, just again to be sensitive to the time. And Jeremy, really, we thank you very much for your time and expertise in sharing that with us. I think it highlights many of the aspects that I had covered in getting ready for doing that marketing plan work. So thank you for the illustration.
No problem. Thank you.
Mm-hmm. And folks, I just pulled us onto our last page, and what we would like to do is we always like to see and hear how this presentation went for you, and also suggestions for future webinars, because we want our education to be both timely and relevant for you as you move forward in your implementing your projects. Lastly, we do have a peer group call coming up on Wednesday, December 16th. And Cheryl, you had highlighted in Tuskegee, Alabama, about some of the good student recruitment work you're doing. And let's save that for our peer group call. And others of you on the phone, when we get to the call on the 16th, we'll send out some questions a couple days in advance to get you thinking. But those peer calls are meant not to be a webinar presentation, but a conversation amongst you all. So we'll that conversation, and the focus will be on student retention. So be ready to share some of your successes and perhaps some of the challenges that you're having, and ask your peers for help in sorting out some solutions. So thank you all for your time today. We really appreciate it. Again, thanks to Jeremy for spending his time and sharing his insights from Normandy Community College. And you'll have a nice rest of the day. Call Angie or I, or send us emails if you have any questions. We'll send out the recording and the PowerPoints and the handout in the next couple days. So goodbye and take care.